I'm Chris Young with the WMNF News headlines at 3:29. The Tampa Bay Times reports 3 new cases of measles have been confirmed in Florida, including one each in Hillsborough and Manatee counties, according to state data. The Hillsborough case was a person aged between 20 and 24 who was infected by the highly contagious disease in Florida this month, a Florida Department of Health database for infectious and reportable diseases shows. The Manatee case was acquired outside of the United States. It's not known if they are connected or if any of those infected are higher education students. The third reported case was in St. Johns County. None of the 3 cases are in children. Measles is highly contagious because of its airborne spread. An infected child in a classroom of unvaccinated children would result in an infection rate of about 90%. A mutated strain of influenza is causing additional chaos during the winter flu season. The H3N2 strain is proving to have some resistance to vaccines and has led to a surge in cases and hospitalizations. A recent report from the Florida Department of Health has shown the number of cases has begun to drop over the past few weeks, but Florida medical experts say that people should still use caution as flu season is far from over. WGCU's Jennifer Crawford reports.
Well, my throat was burning very bad, and whenever I would swallow or eat anything, it felt like my throat was on fire.
11-year-old Andrew Fulweiler recovering at home after being hit with flu-like symptoms over the weekend. His mom, Lori, keeping him out of school.
If he has a sore throat and a runny nose, he's going to pass it on to the next kid from just all the activities and everything that they're touching in school. You don't want to spread infection and give it to the children and anybody that has weaker immune systems.
Infectious disease specialist Dr. Charles Callahan at Cape Coral Hospital.
If you're sick, you should stay home. If your children are sick, they should stay home.
Especially with concerns about a potential spike in flu numbers looming in Southwest Florida.
Florida has a large number of flu cases. I know New York is very, very high, so we may get another seasonal bump because a lot of people from the Northeast come down here for the wintertime and they usually bring their other baggage with them.
The Centers for Disease Control reports 18 million flu illnesses so far this season, 230,000 hospitalizations, and 9,300 deaths. Most of the flu cases are influenza A.
The current strain is what's called H3N2 subclade K. And the reason that's important is that the H3N2 strains tend to be a little bit more challenging to the immune system, especially of the very old and the very young, and tend to lead to more hospitalizations.
Dr. Callahan says the single best way to prevent the flu, get vaccinated. Even if the vaccine is not a perfect match for the new flu variant.
The overall way that the vaccine prevents the flu and flu deaths is immune stimulation. Whether or not it directly is covered by the flu strain or not, it's very important to obtain the vaccine. And studies have shown that people that get vaccinated have less chance of getting sick throughout the flu season from any cause of viruses, such as RSV or influenza viruses. People that are more medically vulnerable, such as the very old, the very young, or the people with chronic medical problems, it reduces the risk of death from the flu.
The latest CDC numbers show that while cases appear to be declining overall, flu-related deaths are increasing. One of the hardest hit groups, children. The most recent data reports 15 child deaths in 1 week for a total of 32 child deaths this year. The CDC says 90% of children who died from the flu were not fully vaccinated.
Children are very vulnerable because they have small airways. So when they get the flu and it causes inflammation of the lining of the airway, they're more likely to develop breathing complications because the airways constrict down.
For Dr. Bernard Shukovach and his wife Caroline of Fort Myers, getting the vaccine is an annual family ritual.
I've been getting the flu vaccine since I was 30 years old.
They attribute being flu-free for decades to yearly flu vaccines that also protect their loved ones.
I don't want her to get sick. Nobody wants to get sick.
I have my elderly mother who is long-term diabetic, and I have some of our kids, our young adult kids, still live at home, and I babysit my grandchildren, and I have my husband. So if one of us gets sick, it's going to spread. It's really hard to keep it from spreading.
Dr. Callahan says it's not too late to get the vaccine as they prepare for a potential surge in local cases.
It's just a concern about overwhelming our emergency rooms and our hospitals and the fact that the flu is so contagious and is probably underappreciated by the average person as far as the seriousness of it.
Meanwhile, Andrew says he plans to return to his 5th grade class.
So I'm doing a biography for my school. I'm doing it on Muhammad Ali.
With completed homework and without any flu-like symptoms.
That was WGCU's Jennifer Crawford. I'm Chris Young with the WMNF News headlines at 3:35 on 88.5 FM and WMNF.org.